Good afternoon. My name is NSTD, Narissa McKinney, and I will be performing the pain assessment, the sleep assessment, and the musculoskeletal assessment. And this is Nikita St. Luke, and he's here to assist me on showing you how to perform this assessment, okay? Now, always remember the first thing you should always do before entering the room entering the patient's room is to always perform medical hand washing technique, and you should always introduce yourself to the patient and explain to the patient why the procedure is being done, and tell them why they have came to us to feel better as a result. Okay, so firstly, I am going to perform the pain assessment, and we have some methods of performing the pain assessment. We have our OPQRST, which is O is stand for onset, and P is stand for palpation and provocation, and then we have our S is for severity, and our Q is for quality. We have our R is for the region of the pain and the radiation of the pain. And we also have S is for the severity of the pain, and T is for the timing of the pain. Okay? So now I'm doing my medical health hand washing technique. And now I'm gonna introduce myself to Mr. Sindhu, and then I'm going to explain to him the procedure what I'm about to perform. Okay? So, good afternoon, Mrs. Sindhu. My name is NSTD, Narissa McKinney, and I'm here to perform your pain assessment.
Okay.
So, how are you doing today?
I'm okay, but I'm having a slight pain at the middle of my back.
Okay, you're having a slight pain of the middle of your back?
Yes.
Okay, so now Mr. Saluk is complaining about his lower lumbar back pain.
Yes.
And it's on both sides of the lumbar, and it's between the thoracic and his spine. Okay, so now I'm gonna then ask him the onset of the pain, okay? So, Mrs. Saluk, can you tell me what was going on when the pain occurred? What was going on when the pain occurred?
It was a regular day to work. At my job, we do a lot of physical lifting luggages, and the pain occurred one regular day at work.
One regular day at work.
Yeah.
Okay, so he then explains the onset of the pain begins when he was at work. So now I'm gonna find out what provoked the pain by I'm using the palpation and provocation technique to ask him. So what provoked the pain when you was to work?
Provoked it?
Yes. What were you doing? What provoked
okay.
the pain?
Okay, well, what provoked the pain is I work 6 days a week, and out of those 6 days, we just lift, and lift. 6 days out of the week. I'm a guy who worked at the airport. I'm one of the guys who offload the aircrafts manually. We take the bags with manual strength off the plane, and we gotta take back bags to put on the plane manually. And it's a lot of bending to be done on the job to get the job done. So that's one of the high reasons the pain occurred.
Okay, so now again, the provoking of the pain is because he does a lot of bending and he does a lot of lifting. Now bear in mind, it's a special way of lifting objects. You don't just stand to your side and then you just bend to pick it up. It's basically you gotta open your legs a little bit, bend your knees, and then fold over to pick up the object. And then you come gas back up and pick up the object. So this is done now. He described, he actually explained to me what was provoking the pain is by doing a lot of bending and lifting a lot of heavy bags, he said?
Yes, luggages.
Okay, all right. So now then I'm going to ask you the quality of the pain. So can you describe the quality of the pain? By me saying this is that, is it sharp? Is it dull? Do you feel a lot of tearing at your lower lumbar between your thoracic spine? Do you feel that? Or is it sticky, dull?
It's just like a sharp pain.
Okay, so it's just like a sharp pain.
Just a sharp pain, yeah.
So does it intermediate, meaning that does it goes and stops or?
Yes, like I said, I work 6 days and 3 days off. So for the 6 days I'm to work, the pain is active.
Okay.
And on my 3 off days, once I'm just home, relaxing, laying down, it's not around. But the minute I go back to work, it's active.
Okay, so then again, he's describing that the quality of the pain is sharp.
Sharp, yes, ma'am.
Sharp, and it's only sharp. It is not a constant thing. It's more like an intermediate sharp pain, meaning that it only occurs when he's to work. Frequently lifting a lot of bags and doing a lot of bending and offloading the plane. So now I'm gonna ask him, can you tell me the radiation or the region of the pain? By me asking him this, I'm gonna ask him, meaning that it's the location of the pain. So does it move from your lower lumbar or anywhere else, like on your clavicle, or does it move like up to your shoulders or anything like that, or on the side? Or I'm basically asking you, if does the position of the pain moves, or it just stays in that lower lumbar?
No, it just stays in one. It just stays in one position.
Okay, so now he just explained to me that the region of the pain, it doesn't move. It just stays to his lower lumbar position. So I kind of like understand what you're saying, that you don't have anywhere else but that lower.
Just the lower, yeah.
Just that lower part of your back.
Right.
Okay. So now I'm gonna ask him about the severity of the pain. Okay. So the severity of the pain is like, we use certain scales, like we have the Wong-Baker scales. We have different types of scales. Sorry. We have the Wong-Baker scale. We have the flax, and we have the numeral scale. Now the flax scales is just basically for children under 5 that they will need assistance from their parents to describe the pain to them, because they can't really understand, they cannot describe the pain for themselves, so they would need their parents' assistance. And for the Wong-Baker scale, we show the kids, because they more likely have like different facial expressions on them. We would show them to the kids like from 7 and up, and then they will then point out to the scale to let us know how the rate, the percent of their pain. And the numeral scale is used for the adults, which when we use that for us, it's the rate our pain. Okay, so Mr. St. Luke, can you tell me on a scale from 0 to 10 the severity of the pain?
From 0 to 10, honestly, it's a 7.
Woo! So he's then saying his pain is on a scale of 7. So on a scale of 7, on a numeral scale is like basically it's more moderate pain. It's kind of like on and off. So, like he said before, he only experiences this lower back lumbar pain, back pain is when he goes to work and he does a lot of lifting and bending. Okay, so now I'm gonna ask him the timing of the back pain. Okay, so can you tell me the time when the pain begins, like a specific time?
Okay, well, right now, if I'm off from work and I have to work the next day, the minute I get to work and we start working like in 5 to 10 minutes, the pain is active. It doesn't take long for it to show up.
Okay, so then again, now he's telling me the time of the pain. So the time of the pain only occurs as soon as he physically works.
Right.
Okay? So those are my methods of dealing with pain assessment. So always remember to always take the patient vital signs. You want to make sure that their pressure is not too high or not too low. And always document at the end of the assessment. Okay? Oh, sorry again. What this is you get a make-sure guarantee. Ask your patient what were they using to help alleviate the pain, like find out like different factors, alleviating factors that which helps them. So, what do you do when they help you to alleviate the pain?
Most time, I just stay home and just relax.
You just stay home and just relax.
Yeah.
And does the pain come back again on your scale of 7?
No.
No. Okay.
No.
Okay, so again, he's saying that when he's home and relax is another good way of really alleviating pain. So these methods, I'm gonna give him some alleviating methods to take with him home to alleviate his back pain. Actually, it can be helpful while working as well. You could always get a back brace that can help you, like when you're working, to support your back and support the way you lift up the object, so you wouldn't feel that lower pain at your lower lumbar. And also you can listen to some soothing music, which the music tends to not to stray your mind away from the pain, and you kind of feel good about yourself. I mean, that's if your job allows you to at the time to listen to music, but you could use the music on your break time. Okay? But you can also like do a lot of stretches before you go to work, knowing that if you have a lot of back pain, because sometimes people exercise to stretch out their muscles before they do anything active. It's like a common thing with athletes. What they do, they prep themselves before they go running. So when you are doing them kind of job requirement, you should always prep yourself. Always do like stretches in your muscles and stuff, and your back, and this will be a way of helping you to to seize down your lower back pain. Okay. So once again, thank you guys so much. This is from the pain assessment, and this is Nikita St. Lou. And always remember to do your medical hand washing technique, and always document. Okay? Thank you. Alright, hi guys, I'm back, and now I'm going to be performing the sleep assessment with Mr. St. Luke. Okay, Mr. St. Luke. How are you today?
I'm good, and you?
I'm awesome. Okay, so now I'm going to perform a sleep assessment on you.
Okay.
I would like to ask you a few questions.
All right.
Okay?
Okay.
Okay, so do you have any family history of sleep disorders, like including like sleep apnea and insomnia or sleep deprived?
Well, none that I know of, but I know my father. He's a guy like, if he was to go to sleep 8 o'clock this evening, or tonight, and he wakes up midnight, he's not going back to sleep until daybreak.
Until daybreak.
Yeah.
Okay, so is he on any medication or anything like that?
None that I know of.
Not that you know.
No.
Okay, so Mr. St. Luke is explaining to me that his father is having trouble, is actually having a disorder of sleeping. In that case, that's sleeping when you go to bed early and you get up in the middle of the night and you cannot fall back asleep. That is a sleep disorder called insomnia, and that's a sleep disorder where you're not unable to go back to sleep. So, can I ask you something? Do you have problems sleeping in the middle of the night or anything like that?
Yeah, recently I've been having problems just naturally falling asleep. So I started taking Advil PMs like every night, 2 tablets a night, and that helps me go straight to sleep.
Oh, okay. So, from my understanding from Mr. St. Luke, he's having problems sleeping in the middle of the night. So, which means that he is also, I am also seeing something that he's probably diagnosed with insomnia again. He's actually taking pills, taking Advil PM to help him to sleep at night.
Right.
Which is not a good thing because too much of Advil PM every night, you can receive some side effects, like it can cause a lot of blood clotting in the system, or it can increase your heart rate, or it can actually be fatal. You understand? It can lead you to heart attack. Okay. It is a good procedure of taking Advil PM, but it only should be taken because Advil PM helps breaking with pain relief or fever or headache or something like that. But it's not something you should constantly use every night to help you go to bed, because those side effects can affect you. Okay?
Okay.
If it's not prescribed by your doctor, you shouldn't take over-the-counter medication because it's not healthy. Okay? So, as I explained to Mr. St. Luke, the Advil PM every night will cause some complication into your immune system, and it's not healthy. So why is it important to sleep? It is important to sleep because it has the body to build on restoration, and get the body ready for preparation. It also helps with our immune system. It keeps us more attentive, okay? And it also helps us in our proactive life daily. Now, if we get insufficient sleep, it can cause a lot of complications, which we can be moody, We could develop isomania. We could develop sleep deprived. We could develop like sleep apnea. We could develop all of these things which could help lost focus if we don't get insufficient sleep. And another thing is, when we have insufficient sleep, we tend to get confused and lost. We will not be attentive. We will be trying to understand, and it's another thing, it could actually play with your mental stability. So I would prefer you get sufficient sleep. And this is another thing, Mrs. St. Luke, at what age are you?
28.
28. Now, during our adulthood, we tend to get insufficient sleep. But for adults, we gradually need at least 7 to 8 hours sleep every night. Every night, because this will help us to perform. Our performance will be more healthier and more stable. Okay, so we have reasons that we have two types of sleep. We have the REM sleep and we have the NREM sleep. The REM sleep is basically the type of is the type of normal sleep we are doing. We are actively going to bed on time, okay? And the NREM sleep is actually we're not doing that. We're not being more supportive or supportive to ourselves. We're not taking sleep seriously. And what that NREM sleep do is that we lose a lot of time and preparation for us. It doesn't make our body to help in growth, because sleep actually helps our body to grow in order for the sleep. Now we have some effects that affects our sleep. When we are emotionally stressed, or we have poor dieting as well, and we are on medication, and we have fatigue, and we're not taking nutritious food. That's another way of losing healthy sleep or not falling asleep. So, Mr. Singh Luke, are you having any of these symptoms? Like you said, you are taking medication.
Yeah.
Medication is a big factor of you that contributes to you to sleep, but it also is an effect, because it tends to your body tends to get immune and used to it in order for you to fall asleep, which is not naturally. Okay?
Okay.
So this is my sleep assessment. I would encourage Mr. St. Luke and anybody out there to always eat more nutritious diet, and do a lot of exercise. Exercises help you too to try to sleep comfortable and better. And you can make a schedule, and you could time yourself on how to be prepared more better on your sleeping time. Okay? So always remember to do your medical hand washing, and always remember to document. Okay? Always document at the end of the assessment. Thank you. Okay, guys, now I'm going to perform the musculoskeletal system. And once again, this is Nikita St. Luke, and he will be my assistant today. Okay? So, remember, I am performing my medical hand wash technique. I took his vital signs, and everything appears to be normal. Okay? So, Mr. St. Luke, how are you doing today?
I'm good, and you?
That's awesome. So I'm here to perform the musculoskeletal assessment only today, okay?
Okay.
So can you turn around for me?
All right.
So now I'm going to assess him from head to toe, okay? So firstly, I'm going to start off with the jugular process. Any pain?
No, ma'am.
He's not having any pain. Can you open him up and move it? Don't move your hand. Just side to side. Okay. Can you look up? Turn your head back. Can you come down? Any pain?
No, ma'am.
Can you turn your head to the right? Don't move your body, just your head. To the left? Okay. So, you can turn it back. Okay, so now it's that everything is in range and he has strength and everything is in motion. There's no lumps, there's no bruises, there's no lesions or anything, there's no swelling or nothing like that. So he is good to go. So now I'm going to take my hand and I'm going to use resistance and he's going to try to push my hand back. Good. Push up. Good. Okay. So now I'm going to ask you to hold your hands. Okay. The skin color is warm. Sorry, the skin temperature is warm. The color is right. So can you do this? Yeah. Flip over. Okay. So then I'm going to ask you to stand up. Now I'm going to take my two hands and I'm going to rest it on his shoulder and I'm going to use resistance, okay? Okay, so let me know if try and move your shoulders up and down. Alright. So his shoulder, any pain or anything?
No, ma'am.
Okay, so he's moving, his strength is very good, very excellent, and he is moving with no pain. His strength is in and range is in rotation and everything. Okay, so now I'm going to palm plate his shoulder down to his elbow to his fingers to see if he has any pain. Any pain?
No, ma'am.
Any pain?
No, ma'am.
So I'm going down to his elbow. No pain?
No
No tightness, no tenders, no anything. And we gotta make sure get to the fingers, to the hands, because the hands have a lot of bones. And you move straight up to the tip. There's no tightness, free of movement. Anything?
No, ma'am.
You want pain there?
No, no.
Okay. So now I'm gonna ask Mr. Singlu to remove his shirt as I inspect his spine and his cervical C7. So now I'm gonna ask you to touch your toes. Okay. So his spine are intact as I palm plate. The spine is have like a little steep, and as he gets back up, can you get back up for me? It's supposed to fall back in place. There's no disease, there's no, as I am looking, there's no sclerosis, like no defects of the bone. Everything is normal and intact. Can you bend your head? Okay. I'm palpating his neck and back of his CV7 from his spine. Any pain?
No, ma'am.
Okay. Alright, so there's no pain here. Everything is intact and he is ready to go. So now I'm going to palpate his clavicle and his spine and his shoulders. Okay? So, do you feel any pain?
No, ma'am.
No pain?
No, ma'am.
Any tightness or swelling? I don't feel anything.
No, ma'am.
Okay, so I'm also going to check under his gluteal folds. Anything?
No, ma'am.
No tightness or anything?
No, ma'am.
Okay. Alright, so now I'm going to have Mr. St. Louis to lay down. Can you lay down for me? And I'm going to inspect the side of his hips, his legs, and up to his toes. Okay? Do you have anything on the side?
No, ma'am.
Any tightness?
No, ma'am.
Okay. So I'm gonna take his foot, and I'm gonna ask him to bend his knees, and I'm gonna ask him to apply resistance as I do this procedure. So can you bend your foot? Any pain?
No, ma'am.
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 Okay, so now I'm gonna apply pressure to his foot, and I'm gonna make sure you palpate the toes of the foot to make sure there's no swelling and there's no tightness in the feet. Anything?
No, ma'am.
And make sure it gets straight up to the toes, okay? No pain or anything?
No, ma'am.
Okay, I don't feel any tightness. There's no feel of no lumps or anything. And you make sure rotating of the feet. No pain or anything.
No, ma'am.
He has full strength and full rotations. Okay, so now I'm gonna ask him to sit on the chair again. I'm gonna check the knees for any tightness. So I'm gonna palm plate the knees. Any pain?
No, ma'am.
Everything feels free of movement. You had any injuries to your knees or anything? Were you in a car accident or anything like that? Any type of... Did you have any surgical procedure done on your knees or anything of your joints?
No, ma'am. No.
Okay. Okay. So everything is intact. Everything is in free in motion. Now I'm going to ask him to stand again. Okay, so what I want you to do, I want you to put your hands to your camera and move the top. Any pain?
No, ma'am.
Move over. Any pain?
No.
Turn to the side. Any pain?
No, ma'am.
Any pain?
No, ma'am.
Okay, so can you lift your hands up? Any pain?
No, ma'am.
Any pain?
No, ma'am.
Straight to the back. Pain?
No, ma'am.
Great. So, this is the end of my my muscular skeletal assessment. Mr. Sinlu has no swelling in the joints, no fluid in the joints, no pain. He's stating everything is freeable, no tightness, and he's good to go. So thank you again. Always remember to, after any assessment, perform your medical hand washing technique, and you always document to the end. Okay? Thank you.